A very good afternoon to you, sir.
Good afternoon.
So before we start with anything, I would like to know your name as well as it's been how many years you've been practicing this and where are you practicing?
I'm Dr. Prashant Mulawkar. I've been practicing for more than 25 years in Akola, which is a city in Maharashtra. Yeah.
We can call it a silver jubilee, right? Okay, so today we're going to be talking about BPH and kidney stone management. So first question over to you for BPH. So why, according to you, are the cases of BPH on rise?
See, the cases of BPH are on rise because of the increased awareness in the society that most of the people are doing executive health checkup or preventive health checkup, and they are noticing their problems. Another thing is our old age population is increasing, our life expectancy is increasing. Because of that, the people who are older are surviving more, and that's why we are having a large pool of patients with BPH.
Heading towards the next one. Why does it become so important for the condition to be diagnosed in its early stage?
See, if you diagnose BPH in early stage, in the earlier part, you can just treat the disease without any medications by doing some lifestyle modifications like how much fluid you would take, what drinks you will take, whether you will take tea, coffee, and all that, what kind of diet you will take. So, with this, the initial part of the illness can be managed without any drug, and after that, once they get some symptoms, we can manage those patients with drugs. Now there is always fear in the mind of people that if I have a prostate, I'll undergo operation. No, that's not the case. Around 90% of the patients with prostate can be managed only with drugs or lifestyle modification. It will be 10% or at the most 15% of these patients will require surgery. And in at least half of these, we can either prevent the surgery or delay the surgery with medical treatment. So that's why they should be aware of that.
Okay, talking about the surgery part, when does surgical intervention become necessary and can it be avoided?
See, once we say that when surgery becomes necessary, that means it cannot be avoided. So if a decision is taken that surgery is necessary, then it's not avoidable. Now, when does it become necessary? When your symptoms are not controlled by medicines, when the symptoms are so bothersome that it is affecting your daily lifestyle routine, then again surgery will be required. Or if you develop a complication because of BPH, maybe like stones, maybe blood in urine, that is hematuria, maybe some problem with the functioning of bladder or kidneys, or if you have a retention of urine, that is the urine is retained and you need a catheter, in these patients surgery will be required. But the population of these peoples will be hardly 10 to 15% of all the patients with BPH.
Okay, so talking about kidney stone management, what is the greatest misconception that people have about kidney stone?
The greatest misconception the people have about kidney stone is that kidney stone can be dissolved. No, kidney stones cannot be dissolved. There are just 10% of the patients who have stones called as uric acid stones. Only those stones can be dissolved, and that too when they are very small in size. Most of the patients that we get in our OPD or in our population are calcium oxalate stones. Now these stones cannot be dissolved, but if the stones are very small in size, maybe 4 millimeter, 6 millimeter, they can pass these stones in urine if they drink a lot of water.
Okay. So talking about some experience part over here. So what has been the most challenging case of kidney stone that you have dealt with and how did you remove patient stone?
What will be challenging, I think we'll speak about a bladder stone. I had a patient who was around 65-year lady. She had a bladder stone of 8 centimeter size, this big stone, and she was having a lot of trouble because of that stone. And I removed that stone through her urinary passage with an endoscope without cutting the abdomen. And for that particular case, my name is featured in the Limca Book of Records as the largest bladder stone removed endoscopically. So that's the most challenging case that I have faced, and I always remember that patient.
Well, pleasure meeting you. And that's all. Thank you very much for your precious time. Have a great time ahead.